Morning all. Welcome to our discussions today. It's hopefully a fluid meeting. And the reason for us gathering today is to speak about our team member vaccine program. And we've answered a lot of questions today, had a lot of communications, and we hope this one also will help answer the many questions that I have in front of me. To start, I just want to give you a statistic. Right now we have 4,100 team members vaccinated. 4,100 have first doses at least. So we probably have about 2,500 more team members to go. And that's the purpose of our discussion today. We do have a lot of questions. We will get to the ones we can here. And if not, you will receive, we will put out answers to all of them for everyone to review. To start, I'd like to introduce our panel of experts. We have Dr. Neville Mavarakai, way to my left, who is, as everyone knows, our infectious disease doc. Dr. Ted Theodore Mattiadis, our chief medical officer, and Dr. Nicole Burwald, who is our chair of emergency medicine. So to open it up, I'd like to introduce Dr. Mattiadis with his presentation.
Okay, I'm going to show just a couple of slides. But before I do so, I want to tell you that yes, I did take the vaccine. Why did I take the vaccine? I believe in the science deeply. It's unbelievable science. It's going to be part of our future in developing other vaccines. Number two, I don't want to get sick. I want to protect my family and friends and this community, and more broadly, the country. This is about getting as many people vaccinated and immune or protected against this disease as possible so we can save lives and we can actually open up economies and get people back to work and get this whole thing straightened out again. And we will not do that until we get about 3/4 of the population vaccinated, or at least immune to the disease. Okay, first slide. Well, all I want to point out on this slide is the area that says spike protein. The rest is a depiction of the virus. However, the vaccine is centered around the spike protein, which enables the virus to get into a human cell and replicate. Viruses cannot live without being inside a human cell and replicating. Okay, next slide. And what's happened with messenger RNA vaccine, which is the science between the only two available vaccines in this country today, is that some very, very brilliant people, and this didn't happen overnight, they've been working on this science for years, created an mRNA, messenger RNA particle, which cannot duplicate or form a virus. But what it can do is get into your cell. Yes, it gets into your cell, but it does not get into the nucleus of your cells. And once in the cell, it stimulates formation of a spike protein, which is benign. The protein itself cannot cause disease. But what it does cause is other cells in your body to make antibodies and to some degree other types of immune mechanisms against the spike protein. So now the next time the spike protein presents itself, it's immediately neutralized. Next slide. This, on the other hand, is a much more complicated slide, and all it's meant to show you is that if a virus attaches to your cell, in this case the coronavirus, it enters the cell, it enters the nucleus, and it takes over your entire cellular and duplicating process. It uses all the machinery that's in your cells to produce other viruses in large numbers, and then they're extruded from your cells and cause tremendous disease because now their numbers multiply very, very rapidly. I would much rather take my chance with an mRNA vaccine than with a virus. Next slide. Keep this in mind. These are the rules in New York State. If we don't use vaccines, we lose vaccines, meaning they cut down our allotment going forward. It's a simple rule. There's a lot of complex nuances to it, but that's basically the rule. So we need to vaccinate people. Next slide. And right now, I think these numbers pretty much match what Mr. Coyne described. We're really only 50% at the north and 40% at the south when we look at how many of our eligible employees have been vaccinated. My opinion is we need to do much, much better. And hopefully I can convince you to do that, and we can convince you to do it. Thank you.
Thank you, Dr. Matiadis. Thank you, Dr. Matiadis. I'd like to now introduce, as I already did, Dr. Mubarakai. Neville.
Hi. So just a few stats, 28 million reported cases or documented cases in the United States, 500,000 deaths in the United States. That's more than all the wars put together. I'm sure everyone has a family member or friend who's unfortunately died from the disease. I do. I lost my father about a year ago. Anyway, we are not safe till every one of us is safe. We have a magic bullet, that's a vaccine. Get the vaccine and get protected. You won't be hospitalized, you will not transmit disease, and you will not die from the disease once you're vaccinated. And you will protect your family members from getting sick, getting hospitalized, and dying from the disease. I think all of us have a moral obligation to get vaccinated.
Thank you, Dr. Mubarakai. And our third panelist is Dr. Burwell from our emergency room medicine, our chair. Thank you.
Good morning, everyone. To echo some of the sentiments you just heard, it was very important to me to get vaccinated. As a physician in the emergency department, we had seen so many patients and continue to see so many patients roll through our doors. And my reason for getting vaccinated is to protect myself, my patients, my family, and those family members include my own children, my parents who are in their 70s, and my next family member who will be born in just 3 weeks. In addition to protecting the healthcare workforce, if we can't be there to support our patients when they come through the doors, we can't provide that care to this community we need to. So we all need to get vaccinated.
Thank you, Dr. Burwell. So again, what we wanted to do today is really get to your questions. That's the focus of our meeting, so we can make sure they're satisfied and you can go on and get vaccinated. The first question I have here, actually, I will take. It says, when can our family be vaccinated? And will SIUH be working with the state to distribute vaccines? So SIUH and Northwell is involved in distribution of vaccines. We have currently 777 Seaview and Empire outlets which we are working with the City of New York to vaccinate our community. At this particular point, we're waiting on vaccines to be shipped, and those schedules will be open, so your family members can opt for those appointments. As of now, our current status in the hospital is just for employees. Our hours are 8 to 4, Monday through Friday, for all employee vaccinations, and we also be at the South site this Thursday, again from 8 to 4, to help with our South site vaccinations. So for now, it's employees and the community. We will working with the city at those 2 locations. Thank you. My next question I'm going to ask Dr. Matiadis to answer. Why is the vaccine still EUA and not totally approved?
The Food and Drug Administration has very strict rules on what needs to be done to have an official approval. EUA, expanded use authorization, is not an uncommon approach in an emergency, and believe it or not, it's not an uncommon approach with a vaccine. It's been done a few times in the past. And they felt that there was enough evidence that this vaccine was effective and safe, but they still needed more data. So they released it under this expanded use authorization. And as the expanded use authorization proceeds, people are tracked Data is accumulated, and the studies are still ongoing in a more strict and controlled environment until they believe they have enough evidence. I don't know exactly when official FDA approval will occur. There's no doubt in my mind that it will. There's been 40 million doses of these vaccines given. The side effect profile is extremely small.
Thank you. Dr. Burwald, I am a nurse and I'm trying to have a baby. Has the vaccine been tested on pregnant people or people trying to have a baby?
It's a great question. Vaccine trials did not include pregnant individuals in the initial studies. Those studies are starting, or actually they're underway currently, for both the Moderna and the Pfizer vaccines. So more data will be known soon. What we do know is that in the initial trials, some female participants inadvertently became pregnant after being enrolled in the trial. It's fewer than 20 who received the vaccine, some received a placebo, but those pregnancies are being watched carefully, and they haven't seen any untoward events at this time. The other thing I'll add is that looking at the rates of people who've gotten pregnant during this COVID period, it doesn't seem to have impacted the ability to get pregnant, infertility, and the question is if you would be infertile from getting COVID. There does seem to have been some propagated information on the internet. So I'll mention that quickly because it's one of the reasons why I think people have this concern related to what the vaccine may do to create antibodies against the spike protein, creating antibodies against proteins in the placenta. That information is not found in any science. It was propagated initially by a physician who has had difficulty embracing vaccination programs for other viruses in the past. But just to summarize, there haven't been any studies to date that we have data on that do include pregnant women, but the women who have been pregnant that are studied so far who are being watched closely have not shown any evidence of any untoward events.
Thank you. Thank you. Dr. Mubarakai, how long is it recommended to wait before being vaccinated after having been sick with COVID?
So if you are sick with COVID, depends on the symptoms, but generally you want a good antibody response. How long that antibody response, which equates immunity and which equates protection, really lasts for, we don't know, but presumably for at least 3 months. So if you want to wait 3 months, that's fine, but the recommendations are as long as you're asymptomatic, that means 10 or 14 days out of the disease, you can get vaccinated. So the answer is you don't have to wait. You should wait at least 10 to 14 days from onset of symptoms, but if you want to wait for 90 days, that's fine. You're immune in those 90 days.
Thank you. I'm going to stay with you, Dr. Mubarakai. Will I need a booster shot to take care of the new strain of COVID that are being discovered?
So that's an unanswered, I cannot answer the question with 100% certainty, but depending on your immunity, it's possible that 6 months or maybe a year from now, you might need a booster shot. Studies are ongoing to see how long the immunity holds for once a person has been vaccinated.
Thank you. Dr. Matiadis, can you explain the actual science of this vaccine versus the science of the flu vaccine?
As I explained on my first slide, this vaccine causes antibodies to be generated by infusing you or injecting you with messenger RNA, which is artificially created in the lab. No animals, no foreign proteins, just this strip of mRNA, which is actually hooked up to some lipids, so it stays soluble and it stays preserved at a cold temperature. The flu vaccine is not created by mRNA technology, and basically it's inactivated viral, inactivated, totally inactive, but it does have viral proteins in the injection.
Thank you. Dr. Burwald, if I get the vaccine when I'm pregnant, will my baby also be vaccinated?
So there's no evidence that the vaccine crosses the placenta. Again, this was not studied yet, but that is a sentiment, that it is not believed to cross the placenta. But what can happen is the baby can receive those antibodies that you get from your immune response from the vaccine. It's one reason why many OBs actually encourage the vaccine in pregnancy later in pregnancy, once the placenta is formed. So that if you have your robust immune response, at the time where the antibodies can cross the placenta, you may be adding added protection to both you by getting the vaccine and to your unborn child by having that vaccine done once the antibodies can cross the placenta.
Dr. Burwald, I'm going to stay with you. What is the best time during pregnancy to be vaccinated? And as a follow-up, has any vaccinated women given birth, and how was their baby?
So I mentioned part of that in my previous answer, that one of the reasons why people are being recommended to have their vaccine in the second or third trimester is to get those antibodies to cross the placenta. Another reason is that there's evidence that high fevers in the first trimester can lead to some congenital abnormalities. So that if you can avoid that side effect of the vaccine, which is the same in pregnant versus non-pregnant women, and not have that fever in the first trimester, it can benefit the pregnancy in that way. At this date, knowing when we started the vaccine rollout and when people may have delivered after, there are women who have had babies. This has not been, there's no published data on the children who have born in vaccinated women, but there have been no untoward events in this population reported either.
Thank you. Thank you. Dr. Matiadis, can the mRNA vaccine cause you to test positive for COVID-19?
If you're talking about the COVID antigen test, meaning the nasal swab, the answer is no. It creates an antibody response. It does not create a false positive test.
Thank you. Dr. Mubarakai, if I had COVID recently and still have antibodies, should I get vaccinated?
The answer is absolutely. If you've had COVID recently, you want a good immune response, and getting the vaccination will provide you with a tremendous booster. There are two things to remember when you talk of antibody response. The antibodies that we measure in the lab are not the same antibodies that are created when you have an infection. That means there are antibodies against a nucleocapsid, which are the ones we measure, and there are antibodies against a spike protein, which are the ones we get after being vaccinated or after we get an infection, which we do not measure. So it's really not recommended that you ever measure your antibody titers, because they don't reflect immunity or they don't reflect non-immunity. That means you can be vaccinated, you will have good protection, and your antibody titers can paradoxically be negative because we don't measure the spike antibody protein.
Thank you. I'm going to stay with you, Dr. Mubarakai. After being vaccinated, is it possible to get COVID, be asymptomatic, and infect anyone with it?
That's $1 million question, and there was some fabulous data over the weekend from Israel and also from Spain, but more specifically from Israel, where the incidence of vaccination in the population has been just tremendous. And initially we thought that if you do get vaccinated and if you are protected, there is still a possibility that you can get infected, albeit be asymptomatic, but still have the possibility of transmitting disease to, let's say, your close family members. But this study in Israel showed that the incidence of infection and incidence of transmission to other individuals, if you've been adequately vaccinated and at least 7 days after the Pfizer and 14 days after the Moderna vaccine, that incidence is zippo, it's non-existent. So the vaccine is extremely effective in you, if you get the vaccine, in preventing disease, preventing hospitalization, and as Dr. Manialis said, preventing death, and it's extremely effective in preventing transmission to your loved ones.
Thank you. I have two questions here from you, the live audience. I'm going to direct this one to Dr. Burwald. If the person developed delayed reaction after 18 hours of angioedema of the tongue and after the first dose of Moderna, what is the policy for the second dose?
If you have a severe allergic reaction to the vaccine, and I'll also inform my friends here on the panel, we wouldn't recommend you to get that second dose. More needs to be known, and we know that your second immune reaction to any vaccine, medication, or anything in the environment can be worse. So if you had angioedema, we would not give you that second vaccine.
One of the cautions for any vaccine is if you have ever reacted to any component of the vaccine, then you probably should not receive the vaccine going forward. A serious reaction, angioedema, if it was really angioedema, is a serious reaction.
Thank you. Dr. Mubarak, can you talk to the concept of herd immunity and conflicting recent articles about this topic as related to taking the vaccine or letting natural progression of disease occur?
So I'm not sure where the designation of herd comes from, but I presume it's a herd of cattle. But it's very similar to a given population. So let's take the example of Staten Island University. And let's say there are 1,000 people working in Staten Island. So that's a herd. The herd consists of 1,000 individuals. And let's say no one has been exposed to COVID. COVID was introduced by someone who comes in, and the 999 patients or people have had no prior exposure and don't have any existing antibodies. Obviously, they're very susceptible. And if you're dealing with a virus like COVID, it can spread rampantly through all these 1,000 individuals. How do you stop it? You stop it only by either letting that rampant infection in the population occur. That means you want all 1,000 people to get infected, or you say, let's stop it. Let's wear masks, let's socially distance, and let's create a protective immunity in that we vaccinate individuals. What happens when you vaccinate people? Well, if one guy gets infected and he has exposure to the another guy who's got the vaccine, who's immune, the infection is not going to spread. So herd immunity essentially is that in a herd, you want as many people as possible to be protected from the infection. And that is normally about 90% of the population. So when we talk of 1,000 people in Staten Island, we're talking of 900 something people having protective immunity against the infection. That means 900 of the 1,000 have to be vaccinated in order for the infection not to spread.
Thank you. Another question from our live audience, directed towards Dr. Mediatis. Please advise, what is the difference between Pfizer versus Moderna vaccines' effectiveness?
They're both mRNA vaccines. Their effectiveness is both upwards of 95%. It was originally thought that Pfizer was a little bit more efficacious, defined by not getting the disease in any way, shape, or form after vaccination. It was originally thought it was a little bit more effective than the Moderna. Right now, the numbers are very, very close. In my opinion, they're equally efficacious. A slight difference in the number of days in between the first dose and the second dose. And a point I want to drive home here is efficacious is defined as inability to get the disease in any way, shape, or form. But vaccines play even a greater role. And it's not only whether or not you can get the disease in some way, shape, or form. It's partly, what else is important is what Dr. Mubarak described is it appears as though you have much less ability to transmit the disease in an asymptomatic state. And clearly, even with most of the variants that have been described, at least at this point in time, these vaccines decrease hospitalization and decrease death to very small numbers, almost zero. So that's a second benefit. For instance, flu vaccine, the major benefit of flu vaccine every year is it decreases deaths and it decreases hospitalizations. Does it decrease cases? It does, but not as much as it decreases hospitalizations and deaths.
Thank you. Dr. Burwald, if I got my vaccine and will continue to follow the rules of social distancing, masks, etc., now what? What are the next steps moving forward?
A lot of this circles around what Dr. Maniatis and Dr. Movarikai just said. We need the community, or at large, to be vaccinated before we can remove these measures. And who knows what measures we'll ever truly go back to again, right? We all seem pretty comfortable in our masks. Until enough of the community has been vaccinated, we still have to really ensure the proper social distancing, hand hygiene, mask wearing to not spread the disease further. So you do your part, you get vaccinated, you wear your mask, you do social distancing, and let everyone else follow, and then we can reevaluate the next steps.
Thank you. We're getting close to our end time, so I will repeat that we will answer all your questions in the chat. And so anyone that we didn't get to or any live questions we'll take care of. Also, I want to remind our hours are 8 to 4, right next door. We are vaccinating today through Friday and South on Thursday. So hopefully some of this information will work towards you getting your first dose. And as John McLaughlin used to say on the Sunday press report, the McLaughlin report, he always gave the last word. So I'm going to give the last word to Dr. Maniatis.
This science works. There's no tricks here. There's no unexpected side effects at this time. Once you vaccinated 40 million people, the chance that any new problem is going to show up is virtually zero. Nothing's perfect, but virtually zero. And I think, as I said, we owe it to our friends, family, the community, and the country. Thank you.
Thank you, Dr. Movarikai, Dr. Maniatis, Dr. Burwald, for your time today and excellent information for our team members. Everyone else, you guys have a great day. Thank you.